Hello everyone, this is Brittany Doherty. This is part 2 of how nurse practitioners can impact secondary stroke prevention measures. We're going to be continuing to discuss how the health belief model can be utilized in secondary stroke prevention. About a third of the stroke survivors typically will not comply with medication adherence within the first 2 years after their first stroke. The nurse practitioner can play a really important role with working in this patient population, especially in the outpatient setting, to help them understand what happened, really dive in and get a grasp on their perceptions, beliefs, and help knock down any barriers that may be standing in the way. Tell them that yes, maybe they had a great risk of having a stroke because of some of the non-modifiable risk factors, such as their age, their gender, their race, their family history of strokes. But there are still ways that they can improve their future or prevent future strokes. Assist these stroke patients with being educated on the disease process. Maintain compliance with medications. Make sure they have medical insurance, or if they don't, that they're set up with a social worker that can help them find options that are available out there. Maybe the patient was a veteran and they didn't know that there were certain resources available to them through the Veterans Association in this country. Continue to make sure that they are following up with the multidisciplinary team that was involved in their care. And as far as modifiable lifestyle choices go, maybe the nurse practitioner needs to be that support system and help guide that person towards AA if they are a heavy drinker, or guide them to understand why controlling their blood pressure will make them not only feel better, but help prevent strokes and heart attacks that come along with uncontrolled hypertension. Discussing a little bit about future research, I think it would be very interesting to do a qualitative investigation on areas that have been shown to inhibit adherence to secondary stroke prevention measures. So maybe in the outpatient neurology office for patients that are being seen for the first time after their acute stroke, maybe they're given a verbal or written survey or questionnaire to really understand what's going on in their brain. Do they know the risk factors? Did they or do they know signs and symptoms of a stroke? Do they understand that when they're feeling a sign or a symptom such as weakness or confusion or slurred speech, that time is brain, and calling 911 and getting to the hospital immediately can significantly impact their outcomes? Do they understand why they were prescribed certain medications and what the side effects of those medications may be? Especially, a medication like warfarin. The patient needs extensive education on diet modifications with vitamin K and weekly lab draws to evaluate their PT-INR. The importance of fall prevention if they're elderly and they use assistive devices, giving them education on throwing away all of their small rugs around their floors to make sure they don't trip and hit their head, especially being on anticoagulants. Are there barriers to any of the treatment plans set in place? Are they set up with outpatient PT/OT speech therapy, but unfortunately, due to their deficits, they can't drive, or maybe they don't have family or friends that can provide transportation. So in reality, they would benefit from home care with home therapies. And again, what are the patient's own beliefs about that disease process and plan of care? Are they on board, or are there still barriers that need to be worked on? A quantitative research design would I think it would be very interesting to look at timing goals of recommended blood pressure after an acute stroke. Typically, after someone has an acute ischemic infarct, permissive hypertension is allowed for about a week or so. This really allows for that area of the brain to be properly perfused. After that, literature does specify that it's recommended to achieve blood pressures less than 140/90. However, there is not a lot of literature determining when that needs to happen by. So after an acute infarct, should the patient's blood pressures be less than 140/90 within 2 weeks, 2 months, 6 months, a year? I think it would be very interesting to do future research on when this blood pressure should be at the goal of less than 140/90. And finally, there are various methods that we have discussed so far that nurse practitioners can utilize to provide these stroke patients with the best possible outcomes. Implementing approaches like the Stroke Protect Project to follow these patients for a year after their first stroke, working with them on behavior modification techniques, or using motivational interviewing to make sure that they are being compliant with their medication. These are all techniques that are very important and really can be utilized by nurse practitioners in the outpatient setting. And I think it's extremely exciting that this literature has shown that these methods are effective, and I don't think they are just effective in the world of stroke. I think that the use of these in post-MI patients or specific post-surgical patients, nurse practitioners have a wide variety of uses that they can be needed for in healthcare, and I think that we have an exciting future, and I think there's a constant need for improvement in secondary stroke prevention. And nurse practitioners are great resources that patients can use to obtain education, the confidence, and the understanding of the importance of not just health maintenance, but also health promotion. And I really hope that everybody learned a little something. Please feel free to reach out if there are any additional questions on this topic. I have a lot of information and I would be happy to share that at any time. Thank you again for your time.